This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right. Well, good morning, everybody. So this is a little medical minute on a recent study looking at part of the post-concussion treatment. So we see a lot of patients here in the emergency department with concussions, and once we're getting ready to discharge them, there's a lot of questions as to what they should and shouldn't do, and good information for parents about school and activities. And this was a study that looked at screen time after concussions. So I don't know if you guys have been around any kids these days, but they may spend a lot of time on screens. So should they do that after a concussion? So this was a pretty interesting trial. It took 125 kids, between the ages of 12 and 25, and randomized them to no screen time or kind of unrestricted screen time for 48 hours after being discharged with a concussion, and to see who recovered quicker. So the first interesting thing was that, guess how much screen time people who just had unrestricted screen time had in 2 days?
48 hours.
Close. 600 minutes. So that's basically 5 hours per day of just sitting around and doing screen time. And then in the restricted or no screen time, they still had an hour a day, still 130 minutes. So it wasn't no screen time, but it was definitely less. And then there was a significant benefit to no screen time or less screen time. The kids who had unrestricted screen time had 8 days until resolution of their concussion symptoms, whereas the ones who had restrictions had only 3.5 days. So kind of cut the time to getting better and the concussions going away in half. So it was a pretty interesting little trial. If there's anything you can do to get kids off screen time, better. But yeah, after being discharged with concussion, tell them to limit their screen time as much as possible, and it can benefit recovery. And that's for the first 48 hours is what this study looked at.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.